So, um, thank you. So for agenda, we're gonna talk through a good chunk of the content that was in your February briefing around co-design, particularly grounding in some of those examples, case studies, frameworks around co-design as you all begin ready to launch your design process in your work groups. So we'll spend a little bit of time doing that today. And then we're going to talk about sort of the logistics and things for launching your work groups. So we've got, I think, almost everybody signed up for a work group. So we'll have time to meet today, but we're going to talk through sort of creating a co-lead or a leader for the work group, agenda setting for your first meeting, things that are going to be happening the next time, all of that good stuff today. So there will be time to actually meet with your work groups a little bit today. And then when we come back, we'll hear from JJ. She's going to be talking about sort of school safety and prevention, and sort of school-based responses. And then we'll close out. How does that sound? Questions, thoughts, concerns on agenda? Okay, we have a few folks who sort of, because of emergency meetings and things, might be sort of coming in a little bit late, or a few folks might need to dip a little bit early, but we're gonna try our best to hold ourselves today. All right. Wonderful. So let's dive in talking through co-design. So were there any, come on, second screen, you can do it. There we go. All right. Were there any initial questions, reactions, or thoughts when looking at the February briefing about some of the co-design concepts or ideas? And also, if you didn't have a chance to look at it, it's okay. We're going to go through some of it. All right. So I come to this having learned from some really great practitioners around co-design. And I initially was trained many, many years ago in human-centered design, that's a way, that's a model for how to engage with communities, parents, families, and design with them. And then in 2019, a article was written that was about sort of going beyond human-centered design with this idea that the people closest to the pain should be closest to the power, and that being able to really shift power to kids and families to be able to inform the services that they receive and the solutions to the challenges they're facing as sort of is that idea requires more than just sort of what human-centered design asks. So why it really matters is that traditional human-centered design, it prioritizes us, the designers, the people who are the ones creating the programs, that are designing the initiatives, writing policies. It centers us in the perspective rather than families. And so it sort of unintentionally reinforces these kind of power dynamics where agencies, systems, organizations hold a lot of the power, and families are sort of at the whim of being able to figure out how to navigate it. And really community-centered design approaches are about collaboration and going further. So there was a few key concepts that were in the article that we shared in the February briefing. The first is that there are some limitations around human-centered design, and that really without kind of cultural context or real-world feasibility, sometimes we end up designing programs and initiatives that don't really work, or work in kind of limited contexts. So in any of your experiences, have you had a program either designed by somebody else or sort of like handed to your community or the folks you're working with, and then you're like, wait a minute, this doesn't totally work. They're missing a huge piece of context for this to work. I see some nods. Are there any like examples that come to mind that anybody wants to share?
Well, I think just this House bill and how we implement this, we've had multiple conversations, or I've brought it up multiple times. What works for the metro region does not necessarily work for Eastern Oregon. We don't have the same resources. And so I think this is actually a perfect example for kind of that outside thinking of how we can actually implement something that can work for all of us, which is going to be really difficult.
Yeah. Yeah. The idea of one size fits all, it just doesn't work here. Yeah. So trying to design something that can take into account the different contexts. Um, so the other key concept from that article that we shared is really that there's a few important principles to be thinking about when you're designing new ideas, new pathways, new programs. And that is one, having lived experience guide the process. Two, community members are co-creators, they're not just participants. Um, so a lot of times it thinks about like you think about sort of, oh, I'm going to have this idea and then get feedback from families, which sort of treats them as participants in the process, not co-authors of the process. Um, and then the last key principle is that it needs to be iterative. So we have an idea, let's test it, let's learn, get some more feedback, and iterate and continue to improve. Um, I think when I first started working in education, it was like a lot of the policy shifts were like, this is our big bet. We're gonna do this big thing and totally shift. Every school district was like, we're gonna buy the new greatest curriculum and like do this big investment instead of, hey, let's test it a little bit, see what works, what doesn't work, change a little, and then slowly start to spread it. So that is a key principle here. And it's really understanding the role. It does take a lot of time to do this work and to really think about that kind of shared power. So, but it can really strengthen a lot of like trust and sustainability in programs. A lot of family serving systems, families don't necessarily have a lot of trust with those systems. And this is one way to continue to build that trust and make programs more sustainable because they're context relevant, they will work and last longer. Um, yeah, Elena, totally, absolutely. That's what the like big pendulum swings of these big bets, and you're like, whoa, slow down, try small tests here, learn and continue. So, um, this is sort of the like traditional power structure that we see, particularly in child welfare, child and family serving systems, is that the government systems hold the most power, family courts, and then their system partners, providers, community-based organizations, and then the smallest amount of power lives with families. And we're trying through this design process to shift that and spread it out a little bit more. Um, So when thinking about in your work groups, who are the different stakeholders that you want to be talking to, listening to, hearing from, invite into this co-design process, then think about sort of where you have folks from each of these categories and whose voices you're listening to. So there's a few different case studies that I kind of hold in my head because it can feel like I have to learn a new way of doing a thing, a new way of planning, a new way of program creation. So is anybody familiar with the Los Angeles County Youth Commission? So, a Los Angeles County Child Welfare Agency has a they have a board of commissioners that guides and regulates what they do. And in 2019, they created a youth commission. It is the first youth-led governing body. It is not just an advisory body. They have formal power and authority to decide on what the agency does and does not do. All of the commissioners are employees of the agency. They are paid salaried workers. It's not a volunteer job. Um, and they have policy-making authority across 37 Los Angeles County departments. This was designed and created through a co-design process. Um, so working with youth to figure out, one, is this the right idea? Two, what are the power and authority the board should have? How should youth be recruited to be on this? What is the tenure of a youth? What is the salary and pay? What is the onboarding and training? What is the selection process for all of this co-designed with youth? And it is the best example that I have in my head of youth or families having real formal authority in policymaking and decision making. It's really exciting when I think about sort of the potential for program changes within Los Angeles County and just youth engagement within Los Angeles County. Like, these youth commissioners have the ability to talk to youth who are in care or youth who are maybe in home receiving services, and be able to build trust faster, figure out what's working, what's not working faster than anybody who's already at the agency. So it's really exciting for the potential for impact. Boston has sort of a similar process around their budgeting. So they have a participatory budgeting process for the city of Boston, and they basically have $1 million of its capital that youth can budget. Being able to decide where money goes for youth serving systems. And so this is some example from a few years ago of the different programs that receive funding that was decided on by youth. So there was a couple different planting urban farming projects, as well as a shelter project and a heating project that were funded by youth. So I offer these as sort of like, I keep them in my head as um, exemplars of what is possible. And I think particularly when I start getting into the mental models of like not wanting to like burden families, not wanting, unsure about whether or not youth could take on kind of fiscal planning and like figuring out funding resources. Like when I fall into those kind of traps in my brain, I try and hold these as good examples of like, no, it is possible. Um, so yeah, Elena, I'll send out links for all of these. Yeah. So how this relates to us is that we can use kind of these community-centered methods to develop the inclusive and effective practices that go into this kind of pathway that we're building. Um, so engaging our youth and caregivers in really responsive solutions. So as I said, in your work groups, thinking about your stakeholders, who are you listening to? Who are you inviting into this co-creation process? And really trying to think about these key principles of redistributing power from those big circles, centralizing the voices of the communities that are most vulnerable, and really being collaborative about building solutions. So I'm trying to think, we have this video. Hmm. Yeah, we'll watch a couple minutes of it. Um,
And so these are some things that they share.
okay. I want to make sure I'm sharing my screen right so that you can hear the sound correctly.
We're able to hear it, at least I was.
Okay, great. Oh. Whoa. Come on, second screen.
Shared. So don't judge me and my child. Don't judge our family, right? If families are coming in and they feel judged because of what's happened, right? They're not going to.
Is there like a weird echo? Is that just me? No? No echo?
We heard okay.
Yeah, we can hear it
Okay,
okay.
great.
Feel connected. They're not going to seek treatment. Problematic sexual behavior does not define my child. It's not who they are. They're more than just this thing that they've engaged in. Give me some reassurance and hope that there's things I can do, that there's treatments out there. Of course, we hope this for everything, but reduce my time from discovering the behavior to getting into treatment. Some additional voices of caregivers is tell me what to expect out of treatment. Be patient with me when I don't understand why I'm here. So a lot of times what we do see is, all of the things you guys shared in the chat about how overwhelming it can be when caregivers learn that their child sexually acted out. They may not understand why they need to be involved in treatment, but really over time, what we do find is that if there's not that judgment, if there's that joining with caregiver, if we let them know you're not to blame, we're glad you're here, we can provide resources for you, that they can really get back on track. Okay. So we'll definitely have.
Okay. So that was a clip from a webinar a few years ago, and it showed some of the findings from University of Oklahoma. They did a bunch of interviews with youth and families and caregivers who were receiving services from them, and pulled out some really key things around kind of that caregiver experience that can be really important in designing like services through this new pathway. So coming back here, thinking about kind of what stood out to you. Are there any perspectives that kind of challenge or validate what we're currently thinking about? Are there any insights that you want to carry into your work groups? So whether it's from the video or holistically, I'm going to stop sharing screen and then let's just have a little crosstalk.
Hey, it's Diane. Sorry. So I loved what she said, but really, I think as a person with lived experience, I always think about things differently than people that work, in the system, because really it's wherever we go we're going to feel judged. It doesn't matter what kind of services we're trying to get. I think that is probably the number one thing at the top of the list when you're trying to get services from anything or anybody. I know this is a little bit more sensitive, um, is that we're going to be judged. And so she, hit it right on the nail. Like, how can we engage these parents or these families to make them feel comfortable? I guess that's probably what stuck out to me about, most, was that she hit it right on the nail. Was it doesn't matter what services we're getting, we're always going to feel judged.
Yeah, Mandy, eliminating shame for families. Yeah.
So, this is Susan Stedke, and maybe this fits, maybe it doesn't, but I have concern that we're changing language that may feed into the shame and how we're viewing this. But in the material that was sent out for today, there's in the recommendations, there's the language youth who pose imminent risk to themselves or others. In the today we've talked about problematic sexual behavior, and I thought that early on in these meetings we had talked about using the language complex sexual behavior because sometimes it's concerning and sometimes it's not, depending on uh, what people understand as being normal sexual behavior at different developmental stages. So I'm concerned that we're kind of mushing into other kinds of language that's more loaded and more uh, uh, less nuanced than complex sexual behavior. And I don't know that that makes a giant difference in what we're doing, but it struck me as I was reading the material for today and seeing what we're talking about today.
Yeah, let me go back to the briefing. Did the briefing use PSB instead of CSB? Ah, it did for, yes. Okay, understand. Yeah, we'll continue to use complex and CSB.
Can we clarify though, because this continues to be a question for me. We're talking about two different populations. We're talking about the younger kids, and I thought we were kind of identifying them as CSB, and then the older kids as PSB. And those older kids being maybe the 15, 16, 17 that have illegal sexual behaviors that are posing a risk. So I don't know exactly where Susan saw that. I don't remember, but I just can't. I brought this up too. I sent an email. I was unable to complete the survey because I was not sure what group we were talking about because it referred to these children, and if we were answering for the younger kids that we were supposed to be focusing on, my answers would have clearly been that we don't have programs in place, whereas there is a system in place for the older kids who are typically through the juvenile justice system. So
I was what
clarification is helpful.
my concern had to do with the younger kids that we were focusing on, and clearly there is a system in place for older kids. It may not be funded as well as it should be, and there may not be resources as comprehensive as we would hope, but my comments had to do with the younger kids.
Yep, thank you, Susan. Jenna, did you?
Yeah, I just wanted to speak to that piece too, because I know we've had some conversations around language. And though I absolutely hear what you're saying, Susan, around not wanting to create shame in language, I do think it's also super important to really focus on the idea of problematic sexual behavior not being indicative that the child is problematic, but that the behaviors are problematic. And so in a lot of the work that we're doing, and like as clinicians and within like the larger field and research, like speaking to the problematic sexual behaviors are more of those behaviors that either they're harming themselves or they're harming others, and therefore they're problematic. Whereas I think complex sexual behaviors is such a broad spectrum that a lot falls within it. And I think the focus of this is really the services for those children who are engaging in problematic sexual behaviors towards others and sometimes towards themselves. And so I find myself torn because I don't want to use language that is harmful or really makes people feel othered. And at the same time, I think it's really important to acknowledge the risk and the fact that, a large portion of these children who are engaging in problematic sexual behaviors are doing so, and there is an impacted child on the other end of it. And then a lot of the research shows that children with illegal sexual behaviors, right, like those who have been adjudicated, those behaviors started earlier on and look really similar. It's just that there isn't the legal follow through because obviously, and I agree with, like, they're young, a 9-year-old should not be charged for behaviors, but those behaviors are problematic. And so I for one use problematic sexual behaviors, and that's really focused on the behavior, and that's part of the work I do with the family is like, your child is a good kid and they've made a harmful choice. And these are the behaviors, right? The behavior is problematic, not the child.
I don't disagree with anything that you're saying, but early on in these conversations, we talked about those instances where people think that it's problematic sexual behavior and it's not. It's normative developmental behavior. And so if we're going to address all of that, then I think if we label all of it problematic, then I think that we're headed, the language dictates the direction or the perception of what we're doing. And I guess I personally think it's better to be more general so we can encompass those non-problematic behaviors. And I think that falls into the education and part of what we're talking about. If it's non-problematic, then we probably don't need to develop community resources or specialized resources because there's not a problem. And I agree that the focus of this is that there is to come up with the resources, but I guess my reaction had to do with how language drives perception. That's all I have to say.
If I could just say, comment on that, and again, I think we're all in agreement, we don't want to do more harm with language, and yet we do have to use defining language to really help determine this process. I also think that speaks to part of this process of the education of so many different groups to help identify be able to better discern and identify what is truly concerning and needs to be addressed through services and what is normative and healthy. So that education piece that I think is part of this process. I mean, that's going to be a big piece of that community and development of education of all different levels and different stakeholders.
Can I just add something really quick, Shannon? I want to make sure too that we are oh yeah, thank you. That's exactly what I was going to speak to. So I do want to make sure, like, as we are framing this conversation, and I know, our facilitators very intentionally did choose the complex sexual behaviors, complex sexual experiences as the terminology that we were going to use moving forward. To address this population, just solely, Judge Vecchi, for that, that reason, that kind of nuance that comes with the identification of when you call something a problem, that it obviously can impact and have some judgment along with it. I do want to make sure that we're keeping, though, the conversation that the behavior that we're looking at that is non-normative, that is outside of the scope of kind of normative of development, that we're not only, as we kind of make this step into the work group, yes, we are focusing on the 0 to 12 population for which there does not exist kind of a larger system structure response, but that we are also kind of navigating and focusing on that kind of 12 to 18 population. While yes, there is a delinquency pathway that can happen, there is, that is such a small slice of the population that is out there with the kind of behaviors that are happening that this bill really is intended to address. So I don't want that population, that 12 to 18, to get lost, or that focus to get lost as we dive into looking at streams to support these families, because it really does go beyond those ones who have had some behavior that have gotten themselves so heightened that they're involved with the juvenile justice system, but a huge population out there that's also in need of additional supports.
Yes, Robbie.
I think that's enough. So to clarify, Ronica, when we're talking about 12 to 18s, we're talking about the kids who are not appropriate for the juvenile justice system. So maybe kids with intellectual disabilities, or where there isn't really a charge, but clearly the behavior is harmful. That's who we're talking about. So we can kind of put aside the kids that are going through the juvenile justice system. Is that what I'm hearing you say?
Right, they do have a pathway, and yeah, it's a combination of both. You know, maybe the behavior wasn't acute enough to get picked up for that sort of delinquency involvement. You know, it's that whole kind of prevention pathway. Maybe there is something happening, and we're also talking about that population that experiences IDD and maybe is not kind of appropriate to be served through that venue. So yes, it's exactly that, Robbie.
Okay, thank you. That really helps.
And not to belabor the point of the language, but I do think, one of the conversations I feel like we continue to have in the group around resources started to have is this idea of how do we make families feel like they aren't being attacked, and that they aren't, kind of on the back burner, and helping them access. And we've talked a little bit about like how DHS showing up at your door, or law enforcement showing up at your door is problematic, like who's the first point of contact. But I think this language piece is also there. So I hear what folks are saying about like, this is how I label it as a treatment provider, a problematic sexual behavior, and we need to treat it that way. And I talk about it being the behavior that's the problem, not the child that's the problem. And I totally get that and appreciate that nuance. And I'm sure there's great work being done. But what I worry about is that initial hook, and like how we are initially labeling this and approaching folks. And if they hear that initially without that work and that entree being done, then are we creating some initial automatic barrier, or folks that are scared, already feeling scared about kind of entering these systems or addressing these issues. And so that is the piece. Like, we can all understand what we mean by complex sexual behaviors, because treatment providers will have that nuance, but families won't necessarily. So maybe using language that doesn't create so much judgment on the front end might be useful, because that's the folks that won't have that level of education, that sophistication and understanding of what's going on here. So just my 2 cents.
Yeah, I think the language is so key. And I think, Jennifer, the larger message there of just like, this is a very hard interaction point between system and families, and anything that we can do to make it easier is like, let's think about that. So it makes me also think, so I sent out a calendar invite for next Wednesday. It is totally optional because we know you all are incredibly busy, and we do want to support hearing from caregivers, parents, youth, to help create opportunities so that if there are questions about kind of what would feel better, that you have space to ask those. So next Wednesday, we're going to have a panel with, right now we have 3, possibly 4 caregivers who are going to kind of share, answer some questions, but also be ready, open for Q&A. So we'll record it in case anybody can't make it, which is totally fine. And if you have some questions that you would want asked, you feel free to send those to me. We'll make sure that they get asked. But we want to sort of create some space and opportunity for you all to have more conversation with caregivers, to inform specifically these questions. Any other questions, reactions, comments for the group? Okay, we finished a couple minutes early for this section. So I'm going to say we take a little bit extra longer break so that you can do more than like one or two things. But if you need to refill a drink and check an email or step outside and stare at the sun, you can do all of those things. So we will come back at the top of the hour. Thank you all so much, and we'll see you in 15 minutes. All right, folks, we'll slowly start coming back. Right. The exciting part, we're gonna start moving to action. Yay! The like adaptive work, we've done a lot of learning over the last few months. There's still more learning to have happen, but we're gonna start moving to action in our work groups. So to reiterate, this our sort of purpose is that it's really developing comprehensive pathways. As Veronica spoke to, it is for developing pathways and recommendations for kids who are under 12 and kids who are older, who are outside of the justice system. So we have 4 work groups: developing community mental health resources, designing a response system, funding streams, and then community education. There is not an even distribution of folks who signed up for each developing a response system. It's definitely the popular one. So if you're in developing a response system and you're also interested in either funding streams or community education, it's totally okay. You can move around and swap. But today we'll spend a good chunk of time in these work groups. But these are our 4 work groups. Today, what we are going to do is you are going to elect a lead or co-leads, create your first meeting agenda. Next, our time together that's on the calendar for next meeting, that full 3 hours will be used for your work groups. There is nothing else on the agenda for that but work group time. And that's sort of how we will continue the rhythm that we'll continue to take, which is that the first meeting of the month, we will have some learning time, some other things that we do together. We'll also have work groups report out on where they're at, what they're coming up with. But that second block of time that you all hold for the second Thursday of the month that we come together, those 3 hours. So this month we're going to hold that time for you on Thursday. Hold it on your calendars. Everybody's going to come use that time. But after that, if you all want to, your group decides that you want to split that up, you want to meet on a Monday, or you want to meet on a Monday and then a Friday, or you can rearrange that time. If you decide we're not going to meet that week and people are just going to do work separately on their own, that's totally fine. We just want to hold it for this month so that it can help be space for everybody to get organized. But you'll be able to be more flexible with the time going forward. Are there any questions about that? Yeah, Jesse.
I put this in my survey, and I maybe that I'm the only one who feels this way, but one of the questions that I have is kind of about the distribution of the groups. And I think maybe it's just the way that I'm sort of thinking about like for instance, like the mental health piece, the way that I've been sort of thinking about that includes community education. And so in my brain, there's actually a lot of overlap in some of the groups. And so when I think about separating out and sort of having the groups work independently like that, I just wonder, kind of to your point about like there's not an equal distribution. I guess I just worry, we have people then kind of working independently, and I if the work is potentially overlappy, how will we know what other people are doing? And you said like, we'll come back and report out. Everything seems so
Yeah.
interdependent. I'm just wondering how that will work.
Yeah, that's a great question. And yeah, I mean, these are artificial divisions, just in the idea that how do you eat an elephant? One bite at a time. You're gonna take one part, we're gonna take one part, we're gonna try and figure it out. But that they're very interconnected, and that holding the principle of collaboration in co-creation and design. And so in that report out, we don't envision it as like facilitators, it to be, hey, this is what we're doing. Okay, now move on. That we're going to come with a proposal. We want feedback. We want ideas. We want to make sure, does that connect with this that you're doing? Maybe we come to your next meeting, maybe you come to ours, or maybe you share a representative from each other. Like there's a lot of ways that we can build the threads so that we don't fall into that where it's like, hey, we're working in parallel and we're not talking to each other. We don't want silos. So yeah, that is top of mind for sure. All right. So in terms of some of the logistics, what we've done is that we created a Dropbox folder. I want to check. That seemed like Google gives some people problems because public systems don't like Google. Fair. So we created some Dropbox folders. I'm hoping folks can access it. If you cannot access it, I'm going to figure out another way. Tashawn and I will problem solve all day long to figure out how you guys can access. So we've created some Dropbox folders, one for each committee. Within your committee folder, there's the original January briefing pages where we kind of described the work groups. So if you want to reference it at all, it's just there. There is a list of proposed agenda ideas. Reese and Nish put together sort of, if you were trying to figure out a like scope and sequence of what should we talk about at the next few meetings together, they've put together some ideas. You can take them or not. Oh goodness, Ronica. Okay. Be safe. And then there's also some templates in there. There is a note-taking template, an agenda template. There's a theory of change for your committee template. So if you want to start thinking through kind of what are the outcomes that you're thinking about, whether, for designing a response system, like what are the short-term outcomes that we're looking for that? What are the activities that need to happen in order for that to be true? So they're templates, you can use them, you can not. But we wanted to put some resources in there. So the homework for the next time that we come together is this would be after we have your next meeting together. So we'll use those 3 hours to work on this. Is that there's sort of a first draft of that kind of theory of change, these kind of like, what are our outcomes? What are we trying to achieve? What activities are important? And then, with this sort of short-term, midterm, and long-term. So this is a screenshot of the template that's in there. Again, you can use it, you cannot. If you're like, I like Excel, you want to put this in an Excel spreadsheet, you can totally do that. So it's just sort of starting to get organized on that kind of vision for your work group. And then we'll go from there. So this is sort of a lot of structure for the first time. And then you all will figure out kind of what needs to happen next. Questions, reactions, thoughts? Okay. Okay. So I want to give time in your work group now again, reminder, your homework to your task today is to select a lead or a co-lead for your work group, somebody to be a representative when speaking out, make sure things are in the Dropbox folder, all of that kind of stuff. Ask, and if there's any questions or requests or things like that, give them to us, like sort of liaise with us. And to create sort of this agenda for your meeting in a couple weeks with us. Remember your homework for that. At the end of that meeting will be to submit sort of we have some short-term, near-term outcomes, some activities. This is sort of our thinking about our vision. Okay. All right. John, do you by any chance know which work group you would like to be a part of? Oh, you're gonna jump to another meeting and come back. So I'll assign you when you get back. Jenna, yes.
So this is Debbie, and I'm not showing up on the list, and I thought I would be in the funding one just because there aren't very many people in that one.
Awesome. Okay. Fun logistical question of are you logging on your computer to be able to do that? Okay,
Yeah.
great. I will put you there. Okay. Awesome. All right. Any other questions, thoughts, concerns? Okay. I'm going to open rooms.